Unveiling the alarming truth, vision loss rates on the rise in America. South Carolina, WCIV, imagine a world where over 13 million Americans struggle with low or no vision. This was the reality even before the COVID-19 pandemic, and shockingly, the situation has only worsened in the past 5 years. The rates of vision loss are climbing, and it's time we take a closer look at why this is happening and what can be done about it. Part 1. Funding and services for those affected by vision loss are alarmingly scarce. For the past 40 years, the federal government has allocated a mere $30 to $35 million for the entire population of Americans aged 65 and older. That's hardly enough to make a difference, shares Lee Nasehi, President and CEO of VisionServe Alliance. This stark reality prompted VisionServe Alliance, the Aging and Vision Loss National Coalition, and the Ohio State University College of Optometry to embark on a crucial mission, to gather and analyze data on vision loss rates across various age groups. Their goal? To create a comprehensive report that can lead to improved services for those grappling with low or no vision. Part 2. We're also producing around 30 state reports that break down this information to the state and even county levels. This helps our member organizations better understand the profiles of the individuals they serve. Who are they? What are their needs? What's their economic and educational background? What is their health status? Nasehi elaborates. To gather this vital information, they analyzed 2 major data sets. The first is the Behavioral Risk Factor Surveillance System, the largest phone survey in the world. The second set comes from the American Community Survey, which is developed and administered by the CDC. This survey focuses on economic and socio-economic factors, education, employment, and income, while the BRFSS looks at health-related quality of life, Nasehi explains. From this extensive data collection, they uncovered some eye-opening statistics about those who are blind or visually impaired. In America, 7.3% of adults over 65 experience vision impairment, while the prevalence rate for working-age adults is around 4.7%, Nasehi states. One of the most striking findings was the connection between income and vision loss. A staggering 37% of the 4.5 million individuals aged 65 and older with low vision live on less than $20,000 a year. For working-age adults, that number jumps to 42% among the 8.7 million affected. Additionally, healthcare access and transportation issues contribute significantly to the rising rates of vision loss. When asked about their plans to share these findings with government officials, Nasehi responded, "In 2025, we're making a concerted effort to raise public awareness and share this information, especially with policymakers. We need integrated services and accessibility everywhere. It's going to require more funding, but it all starts with awareness, followed by a bold plan to ensure more professional vision rehabilitation services are available." The trend of increasing vision loss is not just a national issue, it's a pressing concern right here in South Carolina. Melissa Parsons, who began noticing changes in her vision in her 40s, shares her story. "I visited an eye specialist and was diagnosed with macular degeneration. I was told there's no cure, and my condition would only worsen." Now, Parsons relies solely on her peripheral vision and lives in an area along the Interstate 95 corridor, which has some of the highest rates of vision loss in the state. What we found is that South Carolina ranks 10th among all states for prevalence of vision loss, particularly along the I-95 corridor, says Courtney Plotner, President and CEO of the Association for the Blind and Visually Impaired SC. The Big Data project focused on vision loss rates among 2 age groups, examining the comorbidities and other factors that contribute to this issue. In the age range of 18 to 64, the number of individuals with vision loss was staggering, 8.7 million nationally and over 208,000 in South Carolina. It's no surprise that without vision rehabilitation, individuals face a higher risk of falls, strokes, and deteriorating mental and physical health, Plotner adds. But what's driving these alarming rates along the I-95 corridor? Many factors contribute, including food deserts that prevent individuals from maintaining a proper diet. Poor nutrition and diabetes are significant causes of vision loss. Additionally, there's a shortage of eye care providers in the area, leading to missed opportunities for early detection and prevention of eye conditions, Plotner explains. One of the most troubling statistics from the study was the high rates of depression among working-age adults. It was heartbreaking to see that 73% of individuals in that age group reported poor mental health, Plotner reveals. Experts predict that vision loss rates could double by 2030, making it crucial to raise awareness now. People often think of blindness and low vision as rare occurrences, but that's far from the truth. More individuals in the US live with low vision than with Alzheimer's, yet it rarely gets the attention it deserves, Plotner emphasizes. We aim to use this data to highlight the numbers, the risks involved, and the urgent need for action to support individuals, families, and the healthcare system before it's too late.